morning. My name is Cheryl Schaaf. I am a board-certified family nurse practitioner out of Scottsdale, Arizona, and I work with Dr. Shelley Friedman at Nuvell clinics. We specialize in feminine health, sexual vaginal rejuvenation, body contouring, and injectables. Dr. Friedman is world-renowned cosmetic dermatologist who believes in having the latest and greatest technology, and that's exactly what we have. As far as our vaginal rejuvenation, we have Alma's Femilift, which is by far the best vaginal laser on the market right now. The vaginal laser, Femilift, is FDA approved for resurfacing of the vaginal mucosa. So what this does is it helps with many medical indications, such as stress urinary incontinence, which is where you cough, laugh, sneeze, and leak a little bit of urine involuntarily, which is a very common problem that affects women that often goes untalked about. A second medical indication that the Femilift can help with is vaginal laxity. That is where we lose tone or tightness in the vaginal tissue that can significantly affect sexual satisfaction and sensation for both the man and the woman. So this procedure can help tighten that tissue and restore the satisfaction within sexual relations, not only for the woman but for the man. So it's great benefit for everyone involved. And the third medical indication that the Femilift can help with is vaginal atrophy, which is very common with menopause. It is a thinning of the vaginal tissues that can cause dryness and very painful intercourse. I have patients who come to me oftentimes in their late 60s, sometimes 70s even, who haven't had sex with their husbands in years because it was too painful. And after doing the series of treatments with the Femilift, they're able to restart that part of their life. And it's very satisfying for me as a practitioner to see these improvements in the women that I treat. I also love to educate. So when you come to our practice, there is no obligation to do the procedure when you come in for your complimentary consultation. We like to go down, sit down with you, discuss what it is that you are looking for. We like to tell you in detail what the device does, how it works, show you our beautiful office, and then at that point, if you feel comfortable going through with the treatment, we can do it that day because the treatment itself literally only takes about 5 minutes. So what the device is a fractional CO2 laser. This technology has been around for many years, utilized by plastic surgeons and cosmetic dermatologists to rejuvenate the face. But now we're taking this technology and redirecting it towards the vaginal mucosa. So it's awesome. We should have done this a long time ago. So this is the device itself, and we attach here the laser. So this is the actual laser, and it comes with a cover. We replace this cover with one that belongs to you and only you. So nothing that touches you touches any other patient. It is a very clean procedure. There are other devices out there on the market that are not like this, so just beware when you do your research. This is by far the best. We take the small probe and we insert it into the vagina as far as we can. When we're deep in the vagina, you have very little sensory nerves, so you won't feel much of anything when we're deep in the vagina. As we treat all the way around and come more towards the opening, you may feel more of a little laser snap, very similar to if you've had a laser hair removal. But the point being, you don't need anesthesia, you don't need any topical numbing cream. It's very tolerable, and the procedure itself only takes about 5 minutes. So once we go through the consultation and get the treatment done, your future appointments will be very quick. We recommend that you do 3 treatments spaced in 4-week intervals. So each time that you see improvement, we want to build on that improvement, and you will get the optimal result after 3 treatments. Every single woman that I've treated has had satisfaction in one of the facets, whether it is improvement in the stress urinary incontinence, their ability to work out freely without having to worry about leaking urine, or just enjoying a laugh with their friends and family and not have to worry about leaking urine, to my women who have a little loss of confidence because of their vaginal laxity, regardless of whether it's due to childbirth or age or perhaps even just genetics. And then especially for my women who come to me with vaginal atrophy, who have the painful intercourse and really want to rejuvenate and revitalize their sex life. This, again, it's very satisfying for me as a provider to see my patients do so well. So if you have any questions regarding this Femilift procedure or device, I'd be happy to answer any of your questions here at Nuvell Clinics.